an opportunity arose here at Florida Hospital, now Advent Health, at the time, where they were replacing their entire radiation oncology program to become more academically focused in a private practice setting.
As opposed to clinically focused.
Well, yeah, well, to focus clinically, but they also wanted, to hire doctors that were interested in doing research, because they had a research institute that we were trying to collaborate with, and the Cancer Center was trying to go also more towards this, being able to do research, clinical trials, working with the pharma companies to do that. So that lended a nice opportunity for me to experience private practice, but being able to bring kind of a research, kind of academic approach to it.
You know, what's interesting about that is that I don't know that much about the medical system,
right,
but it sounds to me that a hospital that would end up opting for what this one opted for, having an academic, making it more academically focused, when they are a private practice in the business of doing clinical work, that leads to a dynamicism that it would not have otherwise.
Correct.
It's more difficult to master and accomplish, to figure out how the doctors will spend their times, how to integrate this research, but putting it in that context rather than just getting research from universities and other organizations.
And it's funny that you say that this hospital is now embracing that, and what we were kind of seeing, and it wasn't just at Moffitt, this was kind of going across the country, is that in academic medicine, you have a lot of protected time. I had a lot of protected time. I only had about 2.5 days of clinic. I got a lot of time to do research and other activities like that. That was starting to go by the wayside, with all the changes in the reimbursement patterns, with the insurance companies doing what they were doing. Hospitals and even academic centers were probably end up collecting a lot less revenue. And so they were starting to make their doctors work more and more like you were in a private practice, and taking away some of that protected time. And so we make a lot less in academic medicine, but if you're going to make me start working private practice type volumes, and not give me the protected research time, and I now have this opportunity where I'm going to probably get more private practice type reimbursement, but they're offering me more opportunity to do research and clinical trials.
It's like they're offering you what you wanted to begin with.
Wanted to begin with. So it just seemed like the natural fit, and so we've been here and we've grown the program nicely, integrated well with the surgeons and medical oncologists. And I think they're happy to have us there with this kind of more disease site focus, because now they feel just very confident always referring patients, because they know they're going to get they know that we're going to be up to date on the most modern treatments and the most recent published studies. So I think, and it's not just the radiation program. They've been doing this in the medical oncology program, even in the surgery programs. And so this has kind of been a system-wide thing in that cancer center. And so it's worked really well.